Please, let me be able to help her. This moment, this patient, this person, Ruth, is the reason I became a doctor. I look into her eyes. Will you show the area to me, Ruth? I say. Ruth nods and lumbers over to the examination table. She pauses, exhales, and tries to hoist herself onto it, cradling her abdomen with one arm and grabbing the edge of the table with the other. She grunts, shakes her head, and looks at me, her eyes pleading. She can't lift herself. Vivek and I move swiftly to either side of her and help her onto the table. Then, settled, Ruth shudders, closes her eyes, and lifts her gown. Her abdomen is littered with scars. In the middle lie her bowels, covered with a nearly opaque layer of skin. I watch her intestines slowly move, as spontaneous peristalsis occurs in waves, like large snakes slithering under a thin sheet. Vivek's eyes pop open with shock. I palpate Ruth's abdomen, trying to determine how much skin and muscle I may be able to mobilize to cover her exposed intestines. I sit before her for several seconds, staring at her abdomen, envisioning each step of the complicated surgery necessary to fix her. Suddenly, a comforting and familiar feeling sweeps through me. I feel a kind of calm. I know what to do. I then speak my favorite sentence in the English language. I can help you. Ruth reaches over and grabs my hand. Are you sure? I look into her eyes and smile confidently, reassuringly. Yes, I say. In the field of medicine, we have a saying, see one, do one, teach one. I don't agree with this. If physicians took this literally, we'd kill half our patients. I believe the saying should be, see 20, do 100, teach one. The surgery we'll be performing on Ruth, Vivek assisting, presents many similarities to a tummy tuck. Since Vivek has performed dozens of those, I decide to let him start. Scalpel, please, I say to the scrub technician, Christina. She places the scalpel in my hand. I turn it around, handle toward Vivek. Okay, Vivek, make the incision. He takes the knife, hesitates, and begins to cut along the line I drew on Ruth's abdomen. He incises through her skin with expert precision. Bovie cautery, please, I say to Christina. She hands me the cautery device. I place it in Vivek's hand. Dissect down toward the fascia. He presses a button and the metal tip of the bovie effortlessly glides through Ruth's underlying fat, bloodlessly splaying it open. My eyes narrow. Something doesn't look right. Stop, I say. I move Vivek's hand away. The bovie turns off. Do you see that? I ask him. No. What do you mean? Vivek's eyes, the only part of his face I can see above his mask, lock onto mine. Vivek, I say, don't you see that loop of intestine? His pupils practically dilate. Sweat beads on his brow. My God, I was 2 seconds away from cutting right into it. A single loop of small intestine, the width of a pinky finger, lies scarred and adhered to the overlying skin. In a normal person, this intestine would lie in a completely different position. But Ruth isn't normal. Her previous surgeries and infections have caused her insides to no longer conform to any anatomy textbook. Cutting open her intestine in a non-intestinal operation would be a total disaster. Ruth would have come in for a tummy tuck and left with a colostomy bag. Or, worst-case scenario, in a body bag. I gently place my gloved hand on Vivek's. It's all right. I take over for Vivek, who stands to the side, immobile as a statue, except for his hands, which begin to tremble. I complete the rest of the surgery. It takes 3 hours. I keep Ruth's intestines intact and put them inside her, where they belong. And I flatten her stomach. After I insert the last stitch, Vivek and I...
To keep listening to this audiobook, I've left you a link in the description so you can do it, at no cost thanks to Audible's 30-day free trial.